Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome, everybody. This is our second episode, and I'm so excited. It has been a fascinating week. This week, we're going to focus on medical health in the election because it's so important you understand politics and what's going on. We're going to talk about reproductive health, the pandemic, and gun violence. But I want to say hi to Dr. Atoosa and Dr. Sharon, my amazing co-hosts. I hope you guys are doing well. Let's dive into it. You doing good?
Yes,
Great.
I am.
Good to be with you. So first of all, Dr. Sharon and I had the privilege of going to Oprah's Unity Call, which was Unite for America 2024 with VP Harris. I do want to say, though, we are passionate about these topics, but we want to note that our views expressed here are our own. They don't necessarily reflect this podcast or the associated organizations and businesses we work with. So let's get to it before we get to that amazing call and then the issues we want to address, because I'm sure both of you guys are on social media. There's a lot of misconceptions, and I was just like, we've got to do this and break it down. It's kind of like if you don't understand biology, you won't understand how birthing happens, right? How the fetus develops. So let's talk about it today. First of all, there's something in the news. Eastern equine encephalitis. And I'm sure, Dr. Atoosa, you've heard about it. We talked about West Nile virus, but this one is a little different, and I'll tell you why. First of all, it doesn't happen as frequently and not as common, usually in Massachusetts, and it comes sometimes every 10 to 20 years. This one has a high fatality rate. It causes more severe neurological symptoms in the brain and the nerves, and the fatality rate, like I mentioned, is much higher than West Nile virus. This year, we had cases in Massachusetts, New Hampshire, and other eastern states. Now in the news, there's now a case that went from some mammals to humans. So now we see a human case. The patient is hospitalized, and I got this from ABC News. Dr. Atoosa, Dr. Sharon, anything you guys want to say about EEE?
Well, one of the things I want to point out is that we do have some encephalitis vaccines, but unfortunately, this Eastern equine encephalitis is not one of the vaccine preventable diseases. So we don't have a vaccine for humans in Eastern equine encephalitis, but we do have one for horses. So horse owners can be proactive in vaccinating their horse populations to help prevent the spread of this disease. But unfortunately, other than preventing mosquito bites, mosquito-borne illness, just like with West Nile, there's not much human beings can do to prevent contracting this disease.
Great. Anything else, Dr. Sharon?
I definitely do agree. And we have to really approach this from a preventive point of view and just, prevent mosquito bites, use DEET and, stay indoors during dusk and dawn. And use other mosquito repellent. Long sleeves will help, even though I would tell you, last weekend I was in Galveston and I was actually worried. I spoke to Dr. Keisha also at that time. I was eaten alive by mosquitoes, right? I did use repellent, even though the repellent that I used was not mine. So it didn't last a very long time. And then I had mosquito bite even in my face and on my belly. So
Wow.
that protection is actually really, really, really important. It's preventive measures is what we're gonna have to do for this one.
And then also being on the alert for the symptoms, which are somnolence, headaches. It can be accompanied by fever. So being on the lookout for those symptoms and not dismissing them. And I think there was about 15 years ago, a lot of West Nile virus symptom education, and some of the symptoms overlap, but this one is called sleeping sickness. So as opposed to African sleeping sickness, which is a completely different animal vector or biting insect vector, this one is a kind of like the North, Central, and South American version of sleeping sickness. So it can produce intense sleepiness and lethargy. So I think it's important, especially if you are caring for the elderly, to make sure that this is not confused with something else like new onset dementia, and that elderly are screened. In the early stages of the West Nile epidemics of the 2007-2008 time, a lot of this was confused and people didn't know to screen the elderly for West Nile. And I think that this is a time for kids and elderly to be on the lookout if they're not behaving normally, to get them screened for this. And you can test for it, but you have to get into a medical setting to test for it. So that's the other thing that I would point out.
Great point, Dr. Atoosa. So everybody be on the alert. Mosquitoes are not going anywhere anytime soon here in the South. So be cautious.
Absolutely.
We're all in Texas.
Absolutely. And if there's a mosquito within a 50-mile radius, it will bite me. So I am always on the lookout.
You're like Dr. Sharon because, oh my goodness,
sweet.
I don't know what is going on.
I have that sweet blood.
Okay, so we're going to get a little bit more serious. So I will be fully transparent. I have been all of medicine and health, and I really thought politics doesn't involve me. This past couple of years since the pandemic, really, we've realized how important policies are in politics around healthcare. And then we're kind of surprised because some things that we think that are medical issues are now becoming more political than they should, right? We're going to start with reproductive health. In 2022, the overturning of Roe versus Wade dealt with a lot. And here's one of the misconceptions we're still hearing, that the overturning of Roe versus Wade is not going to have any impact on healthcare outcomes, right? They're thinking decreased abortions, better healthcare, better outcomes for the mother and the baby. But that's not the case. First of all, we're in Texas, right? In the southern states, in the states that have this abortion ban, which are quite a few, there's a report from the Commonwealth, and this said that the U.S. already has the highest maternal mortality rate of a developed nation, the highest, and we're a developed nation, or so that is said. These ratios are disproportionately affecting Black and Indigenous women. For instance, the maternal mortality rate for Black women is 3 times higher than that for white women. And since the overturning, the rates are climbing. And just like in addition to that, post-Roe data is indicating that the states with the most restrictive abortion laws tend to have the worst outcomes overall. For Texas, 20%. We talked about this, Dr. Sharon. 20% increase in maternal deaths following the restrictions of the abortion. There's also a New England Journal of Medicine study that said that in states with these restrictive laws, miscarriage rates of patients are 50% more likely to experience complications due to delays. Because what is it? The necessary D&C, which Dr. Sharon will talk about, right? The D&C, you think abortion, but what that procedure is important about, the inability to provide this timely care is important. Increased mortality, there's data from American Medical Association, JAMA, the Journal of American Medical Association, that projects, now this is really sad, a projection is an increase in deaths by 21% nationwide due to these restrictions on access, with the greatest impact, of course, in Texas and other places, which already have other types of disparities. So Dr. Sharon, we hear this all the time about it. Talk what you need to. What is D&C? I think is important. And let's also talk about this, abortion issue, which we'll get to in just a minute. But, what is the misconception about this overturning of Roe versus Wade?
One of the misconceptions is that a D&C, dilation and curettage, or dilation and evacuation, is only used for an abortion. Actually, no. It is a skill that we are taught in residency. The skill used by many obstetricians and gynecologists to manage a miscarriage. However, once we delay that management of a miscarriage, it has serious consequences for mom. And not even for baby, because at this point, if you're managing a miscarriage, that fetal life is already gone. So the next person that you really have to keep in mind is mom. However, when we have these legal barriers, it actually really negatively affect women's life. Yeah, it really does.
Exactly.
And we already know what Trump and Vance's stance on abortion is. As a matter of fact, Trump took credit for installing 3 Supreme judges that overthrew Roe versus Wade. And even though he tried to sometimes backpedal a little bit in talking about reproductive rights, in terms of mandating insurance to pay for it or having Medicare, Medicaid pay for it, that's not realistic. That's not going to happen. Versus Harris's stance, where she advocates and for Roe versus Wade to reinstall it back into federal law, and to offer the legal protection of physicians who offer this service, not just abortion service, but the life-saving services that we need to take care of people. So it's so that's a big difference between both candidates. And I know you said it earlier, Dr. Keisha.
Mm-hmm. And Dr. Sharon, quickly. Yeah, also, could you quickly explain to people the D&C and what else it's used for? Because I think that this ties into the recent case. And actually, we're going to play the clip really quickly from our event that we were at, the Oprah Unity Call, and VP Harris was talking about, what this is doing. And the family was there from Amber Thurman, who was sharing the story about, and maybe you can go into detail after the clip, about their daughter and sister, respectively, who was was pregnant and had to wait to get a D&C. And because she didn't get the D&C, she ended up what is called septic, which is actually Sepsis Awareness Month. We talked about that in our first episode, that she ended up having sepsis and getting very sick, and it was too late to save her, unfortunately. So we're going to play that clip quickly, and then we're going to get back to Dr. Sharon, continuing on about this, the misconception and what this procedure is. And it's also affecting students, because if they can't train to learn it in all of these states that are banned, what's going to happen in a serious situation when a resident and now a doctor does not know how to perform it? Here's the clip.
In state after state, including yours, these abortion bans have been passed that criminalize healthcare providers. In a couple of states, prison for life, Oprah. Prison for life in a couple of states for a doctor or a nurse who provides health care. And so it seems very apparent
even when the mother's life is in danger.
See, here's the problem with that. So is she on death's door before you actually decide to give her help?
Mm-hmm. That's the problem.
Is that
That's
what we're saying?
Yeah.
That you've got to prove you're on death's door.
Like literally a doctor or a nurse has to say, she might die any minute, better give her now care. Mm-hmm. Because otherwise I might go to prison for life in some cases.
All right, Dr. Sharon, VP Harris is saying, what's going to happen? Does a patient have to be dying? And you tell this story. Does a patient have to be dying until we get help? A very important question. Answer that. And then, of course, talk about the D&C and why it's so important that we know how to do that as clinicians that are in OB-GYN.
So I'm going to back up a little bit and tell you what my understanding is of this case.
Mm-hmm.
This young mom was pregnant. She desired an elective termination. She went out of her state. Apparently, she was late getting there for the surgical D&C, and I will explain that later. So they gave her the abortion pill. Now, most of the times, over 90% of the time, that abortion pill works. But also part of the counseling for that patient is that in the event that it does not work, or in the event that you hemorrhage, you need to present yourself to the emergency room to be taken care of. This young woman followed the instructions. When her abortion pill failed her, she presented to the emergency room. what happened then is that what happens that we deem that you have retained products of conception. Now, how much products was how sick she was at that time on presentation, I don't know. But from what my understanding from reading is that she became very sick. She became septic. Now, you don't want to wait until a patient is septic to actually intervene. Because sepsis, you're on death's door. It's a simple procedure. I promise you, this is a procedure I learned in my first year of residency. So that tells you how important it is, and to be able to use that skill and train, right? So really, simply, this woman should have been taken to the operating room, and a suction D&C should have been performed on her upon presentation to the hospital. Not 20 hours later, and from what I read, 20 hours later, she was truly sick. And my understanding is that they actually opened her. They did laparotomy, which is when we make an incision in the belly, which with an attempt to remove the infected tissue, which is the uterus. Apparently, what happened, her bowels were necrotic, meaning her bowels were dying because she was on pressors, and pressors, we use that in the ICU to keep your blood pressure up. And that typically would divert or try to keep blood flowing to the vital organs, the brain, the heart. And this young woman coded on the table and was not able to be revived. Let me tell you, when I heard her mom speak and just know how simple that procedure is, let me tell you, I fought back tears. And the reason why I was fighting back tears is that I've been in the position where I've had to do an emergency D&C, dilation and curettage, on an abortion in progress. And it is such a simple procedure, and it's such a life-saving measure that we have to and need to continue to offer patients and take care of people. This young mom did not have to die at all. And then my next point is, and I've seen this a lot over social media, in the news, where the former president states that we're doing abortion at 9 months. And even after the baby's born, we decide what to do with the baby. So first of all, that's a lie. That is not happening. We are not performing abortions at 9 months. And we are not deciding
And
what
Dr.
to
Sharon,
do. Yep.
you have a board, you have a governing body that has rules and regulations that you all follow and practice. Correct.
Absolutely, because that person will be reported. I will personally report that person. That is such a bold-faced lie and very damaging to us as physicians. And that it's problematic when a leader takes that tone, because a leader sets the tone. That's very damaging. And no, we're not doing abortion at 9 months, or we're not doing abortion after baby's born. That's infanticide. That's murder. People go to jail for that.
Thank you, Dr. Sharon. You know, there's just like so much complexity to this issue. The legal implications as well. You know, when a doctor's in a situation, if they don't understand the law, though it makes sense, it's dire, what dire means, can they afford another legal case? You know, are there going to be people that are trying to seek, which there are people that are actually trying to look for these cases and may not understand the circumstances. So when you get filed a case, you get filed a case. You still have to go through with it, right? You have to get legal counsel. The time it takes, it's a lot. So I can understand it. And again, remember, the residents are not getting the training they needed and the implication that has, as well as those that may feel like they don't want to go into OB-GYN because of all of this. So it's very, very unfortunate. The Trump and Harris stance, I hope you understand and look into the difference and what the importance is. Also know a president, when they are able to elect Supreme Court justices, as Dr. Sharon said, then therefore still complicit or in another way in putting people in place to do that duty and put it back to the states. If every state has a different law, when you practice medicine and you practice in different states, that makes it more difficult for us to navigate. So thank you for that. The next part, Dr. Atoosa, you guys, this is another issue. We've been dealing with this since 2020. We've been using social audio to amplify our voices and educate and inform, and it's still a talking point. The misinformation, first of all, of the COVID-19 epidemic even being true. The United States had the most deaths. We were in first place with over 1.1 million deaths from COVID. The misconception about the vaccine and the misconception about the handling of it. And actually, during the Trump administration, there was disbandment of the pandemic response team as well. So, Dr. Atoosa, you are a specialist in this. You talk about this all the time. Please talk about these misconceptions. What are the real facts we need to know going into this election?
So, the first thing I want to highlight is that the threat of COVID never went away. So just how society viewed it and the exhaustion of vigilance during the pandemic is what went away, because people decided that they would rather live with the risk of contracting this still deadly disease than to have restrictions on social and economic and other activities. So while yes, COVID became endemic in that it is very common and infections are frequent, it did not become endemic in the way that flu is endemic, because flu is still seasonal. Like the likelihood of getting flu in July is very, very low, whereas the risk of getting flu between September and March is higher, right? So we didn't have COVID do that. COVID is still a year-round disease. So that's one of the things I want to highlight. The other is that COVID can still make you very sick and can still cause post-COVID complications like long COVID and debilitating complications. And it's still a threat to life and health. So those are the things I want to identify first. Second, there's the continued misconceptions about the vaccines, that they cause more harm than they prevent, or that they cause mysterious complications in people, and it's a threat.
Or they alter your DNA.
Oh, they alter your DNA. These are still going around. It's not like those were put to rest. And now it's more we're in the stage where people are just, rather than trying to argue with each other's beliefs, they're just kind of letting live with beliefs. So part of that means that there's less public clashes between anti-vaxxers and pro-science people on the internet. There are now people who are getting quietly advised to not get the vaccine and aren't getting it. And there are people who decided they will never get another one. They got some. They're fine, but they decide they will never get another one. I've talked to plenty of those in my practice. And there's still people for whom there should be vaccine exceptions, like people who've had a full-blown reaction or for whatever reason shouldn't get it because of their underlying immune system defects, shouldn't get whatever vaccine. But that should be individually determined. So the public health recommendation is still to vaccinate and get at least an annual booster. So, and this is the time that the booster is being recommended, September and October, before going into the winter months, because although you can still get COVID in June and July and August, the likelihood of spreading it faster is still there in the winter months when we're inside. And now people are not masking. I know that when I travel by air, I'm one of usually 5 or 6 people on a plane of 200 people wearing a mask. So
I believe it.
I'm probably one of the few people that masks when I travel still. But honestly, I'm probably going to do that for the rest of my life because I think it's prevented a lot of illness beyond COVID even. I don't get sniffles as much or flus. And so I think that's what people should understand. Now, the other thing that's different now versus the first 2 years of the COVID vaccine being available is that now annually, or at least every 6 to 8 months, the COVID vaccines that are available are being updated with the most recent strains. So the most prevalent strains of COVID that are out there are being programmed into the mRNA vaccines. All the vaccines that were ever available almost are still available, but the ones that you're more likely to get when you go into a pharmacy or to your doctor's office is the most recent booster, which contains the most recent strains of the COVID vaccine or the COVID virus the protection is there to the most recent strains. So that's the upside of getting the booster. And now there's, more organized public campaigns, just like there were for flu vaccines, to get your flu and your COVID booster at the same time. And so all of that is out there. But the misinformation remains, the misconceptions remain, and it's still up to us to talk one-on-one with people that we know to help them to come to the realization that the vaccines are safe. Again, I think that a lot of people lost faith in the public health system, and the most important thing that can sway someone is a trusted friend or physician speaking with them.
That's a great point, is trust. And, during the Unity call, we met some amazing people. I listened to Governor Whitmer, and then Lieutenant Governor Gilchrist actually was sitting next to me. And something that Dr. Sharon said, and I agree, and when he was explaining it, is that the government also sets the tone during this time. It's setting the tone for how we appreciate and trust science, how we follow the rules. And during a pandemic, which is an unprecedented time, that sometimes shutdowns are necessary. And it's not the doctor saying this. It's everyone in a group coming together, making this decision to keep everyone safe, not just you. You can be safe and well and healthy, but your neighbors may not be. And we all live in this world together. So I think that we need to set the tone. And that's why we need to know in this election the importance of having a government that trusts science and understands pandemic response. And you have to be ready. It's like your house. You have things, storm windows, if you need them, ready in the situation of a storm. And that was a bad storm. Again, we had 1.1 million deaths. Just to let you know, Trump's stance on it is he has a stance basically, and we know what happened when he dismantled the pandemic response team, but he did develop the Operation Warp Speed, but later he kind of distanced himself from it. So you do and look at someone's stance, look at their record. Are they staying consistent in their messaging? Harris's stance as vice president was that she strongly supported. She emphasized the importance of science, public health, federal funding for vaccines, and testing. And by the way, testing this coming week, and as we actually have this episode come out, by the end of this month, which is this month, go to covidtest.gov. They will be available for more testing. Very important. Any last minute thoughts on that, Dr. Atoosa?
No, I think that you summed it up beautifully. And that is that when there is a consistent, systematic government response, a lot of times people are more trusting of what comes out of that government response. And the wavering during the early stages of the pandemic was scary to people, the changes that kept on happening from CDC guidelines and all of that. So I think going forward, not just with this pandemic, because it will not be the last. I hate to be an alarmist, but the data is there and the predictions from epidemiologists have been there for over 20 years that we will not just have one pandemic, but we'll have a series of pandemics. So COVID was the first. We did not handle it well, at least in this country. We did our best, but honestly, we did not handle it well. And I think there was a lot happening both at the national level and in community level situations that made that difficult. But hopefully we will take lessons from it. And if a leadership is put in place that values public health, that will take the lessons learned during the early stages of the pandemic and not repeat the same mistakes during the next one, which we don't know when it's coming, right? But the predictions are there that within the next 3 to 5 years, we will have another super pathogen like COVID. So we need to be prepared. Just like with climate change, we can't just rest on our laurels, during the pandemic as things slowed down from a commuting perspective. We made strides with carbon reduction that we hadn't made in decades, right? So the planet did a little bit better during the pandemic when human activity slowed down a little bit. But we can't count on that, right? We can't just be like, oh, we made a difference. Now there's no threat to climate change. We still have an imminent threat within the next 30 years of total climate destruction. So we need to act on that. So all of these things are interrelated, and it's not unrelated that we have pandemics and climate change at the same time. So I definitely think that a government that addresses those things in a holistic, systematic way is important.
Great points, Dr. Atoosa. Thank you all for that. All right, the last segment, and unfortunately one of the most disheartening that we need to talk about this time, and again, look for part 2 when we talk about more of the healthcare policies and Medicare and Medicaid, but is gun violence. It's a public health issue. And the misconception, again, is it's only a criminal justice issue. It's not that bad here. We need guns. A lot of things we're hearing. But it has been a part of the public health crisis and the conversation that I've known. If you guys don't know Dr. Roger Mitchell, we've had this conversation. He's a forensic pathologist and now actually president of Howard University Hospital, about the importance of understanding how we got here with it. It's multifactorial. It's not a black or white issue. But what I really liked, before we get into Dr. Atoosa and Dr. Sharon, is that during the Unity call, during Unite for America 2024, they talked about it. The stories are disheartening. I've shared before that I personally have a son who was in college and witnessed it because there was gun violence on campus. And it's disheartening when it hits home. The thing that we all have to understand is the other side, is the people that want the guns. And VP Harris shared that. She's like, I'm a gun owner as well. It's not about that. It's about what she's proposing, right, is having gun restriction laws, is not having AR-15s. And I'll tell you from a pathology standpoint, and Dr. Roger Mitchell can attest, is that the damage that does to the organs, the damage it does to the organs is that it is a military weapon, should not be there. So there have been questions, and I think if people understand you can still have a gun, but not this type of gun, you can still own a gun, but you need to have restrictions, right? People need to be able to pass. You need to have a background check. It keeps us all safe. And when our children are dying, and when it's the number one cause of death in adolescents, the number one cause of death in adolescents should not be gun violence. In the United States of America, we have a problem, and it is a public health crisis. Dr. Atoosa, I'd love to hear your points about this because you're a pediatrician.
Yes, I'm a pediatrician, and I was actually chair of the Texas Pediatric Society Injury Prevention and Environmental Health Committee from 2012 to 2016, when this became initially an issue where medical professionals spoke out about gun violence and then got censured for doing so by courts. And people don't remember what happened 15 years ago, but doctors in Florida and Texas who were speaking to gun owners about securing guns in their home and preventing violence with guns, or preventing children from accidentally getting a hold of the guns in the home, were court ordered to stop talking to their patients about gun violence. So even before courts came into the exam room and the operating room between OB-GYNs and their patients, and to interfere with women's health care, courts came into exam rooms to interfere with pediatricians and family physicians speaking to families about injury prevention and prevention of gun violence. So I was part of initial, campaigns by physician groups, including the Pediatric Surgery Association of America and the American Academy of Pediatrics, petitioning Congress and petitioning the executive leadership to codify laws that enabled doctors to do this injury prevention work, which is speak to parents about prevention of gun violence. And then the arc of the past 15 years unfolded, right? So as the administration changed and we transitioned from the Obama to Trump administration, it became increasingly difficult to talk about gun violence without that polarizing effect, even though the research is so clear. And recent cases have shown that easy access to guns is the difference between gun violence erupting, and especially school shootings and mass shootings, versus all of the other things that come from gun violence. So the difference between our country as an industrialized country versus other countries like European countries like Australia and New Zealand is that gun ownership is super easy in the United States and often does not require the checks and the preventative steps that might prevent the kind of violence that we've seen break out. And that's why we have a 2 to 3 school shootings a week. That's why we have a mass shooting a month. That's why we have the highest death rate from gun violence in the world. And that's why it's now become a leading cause of adolescent death, as you pointed out. Guns were always a leading cause of suicide death in both the United States and in some other countries. But this is the first time in the past 15 to 20 years that it's come into the public eye as much, because it's become a mass shooting tool, actually since the late 90s. So now 25 years we've been dealing with this, since Columbine. We've been dealing with gun violence on the school level or on the societal level or in the public spaces, and all of it, about most of the time, guns obtained by people who should not have been able to obtain those guns. And if simple common sense laws were in place, like background checks, like psychological evaluations, then those kinds of things would not happen. So someone with a history of violent behavior should not be able to obtain a gun. A minor should not be able to get their hands on a gun unsupervised, right? So there is gun culture in the South, right? So you teach your 9-year-old to shoot a rifle because you're teaching him to hunt. I have lots of those patients in my practice. I talk to them about sensible ways to make sure that their children are using guns safely. And with recent cases, we see that some of these young people were so disturbed that they were actually threatening gun violence in their schools a year before they did it, and no one acted. The most recent case of a mass shooting in Texas, that was the case. So,
wow. And I'll just say one thing. This is real time. Today is September 22nd, 2024, that Birmingham right now is having a manhunt looking for the shooter in Birmingham, Alabama. 4 killed and 18 injured as of now. I'm sure that's going to be changing. And it's continuing. It's becoming to where we are numb of this conversation. I'm telling my age, but when I was in my residency and we had to do forensic pathology, I was there in D.C. and Maryland during the sniper event where you remember the team of individuals who went around just shooting random people in it. Yeah. And it became so real to me at that time. And I wanted to also add that forensic pathology and the role that they play, they go and they look and they find out the history around the individual. All that data is gathered. There's conversations had between a group of people, and it goes into looking at what's going on. What is the profile of these individuals? What can we do to prevent it? Really, a lot of things in forensic pathology play a good role in public health, from newborns. And you remember the time when newborns had some instances of death from their heads in the slats of the crib. They were changed based on forensic pathologists, looking, examining the slats. They go and to the scene of a crime, unfortunately, or where the deaths have happened, and investigate it. And so it's so important of what I call the death story. And we don't want it to get to that point where it is a death story. So let's get it into a story of attacking it. I agree. If there's food left around that shouldn't be there, someone's going to eat it. My kids will. If I buy more food, they eat more. So let's not have guns around so that more people are getting shot. I wanted to go to Dr. Sharon, though, because, I was reading more, and another part of this is how gun violence is affecting those that are pregnant, and we're seeing around women that are in violent situations and what they have to deal with. And I'll briefly say, Dr. Sharon, that it's important because you're sometimes the only person they can talk to, and they have to come to you for updates. So when you have a president like Trump who's on the stance of, and actually for the NRA, and stands with the NRA, which there's nothing wrong with that, but when he's for no gun restrictions, and then you have a future, hopefully, president, as well as a VP who's with Biden, who is for gun restrictions, but not wanting to get rid of people's guns, it can do a lot. It can have a lot of effect on the mother and the woman and the pregnant person. So what are your feelings right now about the climate with gun violence?
Gun violence affect everyone, even women of reproductive age. And I've seen it. I've seen it in my career where we've had to take care of pregnant women who've been the victim of gun violence. So it's not just the issue that happens in a school. We've seen it. It's happened in churches, movie theaters. So, just about everywhere. So, and many places where a pregnant woman can be, or and can become a victim or end up in the crossfires of a gunfire. So I've seen that. So that affects everyone, not just teenagers, not just the school kids. We're all affected by that.
Thank you, Dr. Sharon. So we have talked about three main issues today. We've talked about reproductive health and justice and how that's going to be important in the election, and the misconceptions around it and the facts. So please remember that third trimester abortions are not happening. It's actually less than 1% of cases are third trimester, and they're not elective abortions. They are those that are needed in emergency situations. Also, we talked about the most importance of the pandemic response, and around the COVID vaccination and other vaccinations. So Dr. Atoosa, thank you for that. Lastly, we talked about gun violence, which affects all of us. Adolescents, unfortunately, number one cause of death right now in the United States, and how it affects pregnant persons. So important. I wanted you guys to remember this as well, not just presidential elections. When we're talking about healthcare, you need to understand a little bit about the government, what the president can do, and what your state. So it's important to be able to know when to vote and how to vote, just not in presidential elections. But please understand, the president has influence over certain policies. That includes shaping the future of Medicare and Medicaid, the Affordable Care Act. The president can also set priorities for public health funding, like the agencies for CDC and FDA, and guide national responses to crises like the COVID-19 pandemic that we talked about. States, however, hold substantial authority. So understand, aspects of healthcare like implementing public health initiatives tailored to local needs. A good example is California. So anti-tobacco campaigns. They've been a leader in implementing smoking cessation programs and policies like banning smoking in public places, which I love because I don't like the smell of it. And other states may choose not to follow that. So the flexibility allows states to address public health concerns with the most pressing issues for their population, or what issues they do not care about, which is important for you to know who you're voting for and where they actually stand on those issues. Additionally, many states have the control how they implement a federal policy. For instance, we just talked about Medicaid expansion under the Affordable Care Act. The ACA allows states to expand Medicaid coverage, but not all states have to choose to do so. States like New York embrace the expansion of the healthcare access for low-income individuals, but other states like Texas, where we are at, opted out, leaving many residents without expanded coverage. We will talk about that future, but I want you to understand the importance of voting, not just in this election, but in state elections, and who you are voting for as well. So Dr. Atoosa, Dr. Sharon, any final thoughts? The unity call, again, being there was amazing because I think we need to, our voice matters. Everyone's voice matters, but clinicians have to understand what legal implications are coming in this election, what the future of medicine will be for the residents and medical students that are coming after us. So let's vote wisely. Dr. Sharon, Dr. Atoosa?
Well, I just want to make sure that everyone has gotten their voter registration card. They know where it is.
Yes.
They know where their election is. You've signed it appropriately, so it's legal. And where their election centers are, and that they're making a plan because a lot of times healthcare workers are busy and we don't get to the votes. So I usually vote early if I can, just so my vote is counted. So anyone can vote early for any reason. So I would advocate early voting. I encourage people of all walks of life to get involved with voting. And it is really the fundamental way that we can make a difference in our system of government and therefore in our public health system. And I also encourage people to talk to their friends and family about these issues as we approach the election, because I think that issues of public health and safety are often not the ones, or healthcare access are not the ones being discussed in family gatherings and among friends. And people are trying to be so apolitical to prevent disunity. But I think it's so important to engage in these conversations just with a loving and open heart instead of being aggressive and on the attack, because it's also part of our democracy is to be able to engage at these grassroots in a unified and loving way. No matter how you vote, I'm interested in hearing your thoughts, and I talk to my friends and family that way, and have come to a point where I know that I'm doing my utmost and to bring about a better world. So it gives me a little bit more peace and serenity when I'm approaching people, even if they have a completely different viewpoint than me. So do your utmost and get out the vote.
Yes, get out the vote. Thank you, Dr. Atoosa. Dr. Sharon, final thoughts.
I encourage everyone who are eligible to vote, register to vote. And if you're already registered, check your voter registration and check it often, because here in Texas, they've actually purged over 1 million individuals off the voter list. So it's important to definitely check. I do early vote also, just because I'm an obstetrician gynecologist and anything can happen. So I tend to early vote and try to get there within the first day or so of voting. I can't be apolitical. I've never been, and I don't think I'll ever be. And especially in a time where reproductive rights is on the ballot, and it's going to be important for us to fight for it. I just don't have it in my bone to be apolitical, especially in a climate where they're criminalizing physicians for taking care of patients, taking patients to the brink of death and watching people die because we are afraid of being prosecuted, arrested, and thrown in jail. So when you're voting, please know what you're voting for. And for me, if I had to choose one voting issue, and there are many, right? There are many in this election, but if I had to choose one issue to vote on, for me, it would be reproductive rights, because I see that every day.
Thank you, Dr. Sharon. And everyone, we actually developed an abortion talking points sheet that will be in the show notes, so you can see that and read it. The conversation is important. The terminology and the words that we use are also important. So let's be mindful of the people that are going through these. The stories I heard were heartbreaking, and when I hear stories from Dr. Sharon as well. So thank you all for that important information. Get out the vote and vote, everybody. Till next time, when we talk about healthcare policy, Medicare, and Medicaid, have a great evening, rest of your day. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life.
Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.